My name is Beatrice Banos, and today I will be discussing mental illness, autism spectrum disorder, and how psychological and neurological conditions affect individuals in modern day society. I chose this topic because it was quite controversial and because it's something that's not commonly addressed amongst many people. There are currently 200 mental illnesses classified amongst the healthcare providers, and basically I wanted to discuss this topic because it hits close to home for me. I personally suffer from anxiety disorder and depression, and my son was recently diagnosed with autism at 23 months. So it is something that I believe not many people are aware of and not many people discuss commonly, but I believe it's definitely something that needs to be discussed amongst the community, and it's something that needs to be spread. Awareness is not always available to everybody, unfortunately. So that is why I chose this topic today, just to address mental illness and basically how it affects autism spectrum disorder. Because many of you may or may not know, but the majority of mental illnesses can be linked to those who have autism spectrum disorder. So I basically chose this topic so I can help spread awareness on it and also to learn more about this topic. So I basically put together some statistics. Basically, mental illness is an issue that affects millions of people. It is said that 1 in 5 Americans struggle with mental health related issues. 1 in 20 Americans live with serious mental illness, including schizophrenia, bipolar disorder, or recurrent major depression. Basically, when we focus on a person's mental health, we look at the ways in which it impacts their thoughts, emotions, moods, abilities to relate to others, efficacy at work and school, or behavioral choices. So, in essence, when their mental health is compromised, it impacts all different areas of their life as well as their loved ones. According to the World Health Organization, 800,000 people commit suicide on a yearly basis. Suicide is basically the second leading cause of death between the ages of 15 and 29-year-olds. For every contemplated suicide, or for every completed suicide, there are 20 contemplated suicides. Mental disorders double after trauma, such as participating in or being victimized by war or being a victim of natural disaster, unfortunately. And it is also the leading cause of disability in the United States. It is viewed as the leading cause in a combination of substance abuse and mental disorders. There's a very high correlation between mental disorders and an increased risk of getting sick from other diseases such as HIV, diabetes, or even injuries caused by self-harm. So basically, I just wanted to go over some of the facts and start discussing more into the topic. Basically, most individuals with mental illnesses find themselves hiding in fear, feeling ashamed, or suffering alone due to societal expectations. It is actually very hard for them to keep going in this day and age just because bullying has become such a major problem. There are different factors that may cause mental illness, which I will be discussing, but I definitely do want to point out that in society we definitely do have a problem with bullying, and it does cause individuals to suffer alone. It causes them to face their battles on their own every day because they fear that they will be bullied by others or they will be ostracized. It is something that it has become a negative view. It's not something that you can say openly, like I'm having anxiety or I'm having a panic attack, without being looked at like you're crazy. So I basically wanted to go over the mental illnesses and the categories first. So basically, mental illnesses are broken down into 5 main categories: anxiety disorders, mood disorders, schizophrenia and psychotic disorders, dementia, and eating disorders. Each of these categories may have mild severe manifestations in an individual and are debilitating in their own way. So, anxiety disorders. Anxiety disorders affect approximately 40 million Americans aged 18 years and older. Anxiety disorders lead to individuals who experiences stress and bouts of fear and apprehension. There are several conditions diagnosed as a result of anxiety, such as panic disorder, obsessive compulsive disorder, post-traumatic stress disorder, social phobia, and generalized anxiety disorder. Symptoms associated with these disorders include panic attacks, pain, nausea, headaches, nightmares, obsessive thoughts, and fear of leaving the house. So the next disorder that is commonly seen with mental illness are mood disorders. They're very tricky in the way that they can sneak up on you. Basically, it is estimated that 1 in 10 adults will suffer from a mood disorder. The most common mood disorders are bipolar disorder and depression. There are two types of bipolar disorder. Type 1, which consists of manic episodes that last at least 7 days and may require hospitalization. Depressive episodes occur as well, lasting 14 days when they do have these episodes. Having manic and depressive episodes at the same time is possible with bipolar type 1 disorder. With bipolar disorder type 2, it is defined by a pattern of depressive episodes and hypomanic episodes, but not full-blown manic episodes. Basically, mood disorders also include depression. Much like bipolar disorder, it consists of mood changes that may disable you and affect your everyday life. Symptoms of depression include persistent, sad, anxious, or empty mood feelings, feelings of hopelessness, pessimism, irritability, feelings of guilt, worthlessness or helplessness, loss of interest and pleasure in hobbies and activities, decreased energy or fatigue, moving or talking more slowly, feeling restless or having trouble sitting still, difficulty concentrating, remembering or making decisions. Insomnia, oversleeping, or even attempts of suicide are very common with depressive disorder. Sometimes you can see a more physiological state affected, such as aches or pains, headaches, cramps, digestive problems, that don't have any clear physical cause and do not seem to ease with treatment, but are in fact there due to psychological disorder. Psychotic disorders are the next on the lineup. Psychotic disorders are serious brain disorders that are marked by significant changes and disruption in both cognitive and emotional function. Examples of psychotic disorders include schizophrenia, dissociative identity disorder, also known as multiple personality disorder, drug-induced psychosis, and schizoaffective disorder. The next up on the lineup would be dementia, which is a term that is most commonly coined for the elderly. However, dementia can occur to anyone due to head trauma, Parkinson's disease, HIV, substance abuse, Alzheimer's disease, or any neurological dysfunction related diseases. Dementia entails a disruption of consciousness and cognition. Symptoms may include changes in short-term memory, difficulty finding the right words, changes in mood, apathy, confusion, difficulty performing everyday tasks, being repetitive, a failing sense of direction, or struggling to adapt to change. Much like dementia, eating disorders is also the last category of mental illness, and basically eating disorders have often plagued adolescents and females and males trying to fit in school. It is a very serious mental illness which can even be fatal, and it is mostly fueled by societal expectations. Eating disorders are serious and chronic disorders that can be life-threatening, although there are various symptoms depending the disorder. A few common symptoms are overeating, reduction of food intake, feelings of depression, distress, concern, weight, poor body image, and poor self-image. So, theories behind the causes of mental illnesses. Psychologists and psychiatrists alike have several theories as to the extent and severity of mental illness that may lead to mental illness being more than just a change in thought, behavior, emotion. There are several other factors to take into account, such as environment, genetics, and whether it may be hereditary. Basically, I will also be discussing historical, cultural, and religious influences that basically go over how mental illness comes about. So, Greek philosophers had the best thought processes. They were the greatest minds of all times. Socrates and Aristotle were early thinkers who wrote about the mind and tried to understand and analyze what influence the brain has on the mind and how it impacts our behavior. Aristotle believed that true intelligence emerged from the heart and not from the brain. Aristotle wrote the first known text in history called Parapsyche, which means about the mind. In this writing, he laid out a foundation of reasoning that would determine the direction and influence of modern day psychology. Much like the Greek philosophers, Hun Tzu was a Chinese Confucian philosopher who lived during the Warring States period. He emphasized on the regularity of orderliness of nature. He basically described the Chinese orderliness of nature as a yin and yang. This is actually something that is often misconstrued as good and bad or female male. The true meaning of yin and yang is that they're both complementary forces. The yin represents weakness, softness, cold, and femininity. In contrast, the yang represents force, hardness, heat, dryness, masculinity. Most of us in modern day society have different interpretations of yin and yang, and they're basically complementary forces that are needed in order to reach equilibrium. It is said that equilibrium between yin and yang are essential to the physical and psychological health. The Chinese thus believe that mental processes are central and associated with the physical body that causes mental illness. So we have several grand theories of mental illness, such as analytical and developmental theories, which are theories of development that provide a framework for thinking about human growth, development, and learning. If you have ever wondered about what motivates the human thought and behavior, and understanding these theories can provide actual useful insight into individuals and society. Some of the theories often were thought up by Freud, Jung, Erickson, and Kohlberg. Another theory that also has to do with mental illness is behavioral theories. Behavioral psychology, also known as behaviorism, is a theory of learning based upon the idea that all behaviors are acquired through conditioning. Advocated by famous psychologists such as John B. Watson and B.F. Skinner, behavioral theories dominated psychology during the early half of the 20th century. Today, behavioral techniques are still widely used in therapeutic settings to help clients learn new skills and behaviors to help with mental illness. Cognitive theory, much like behavior theory, is basically a branch of psychology that studies mental processes, including the way people think, perceive, remember, and learn. As a part of a larger field of cognitive science, this branch of psychology is related to other disciplines, including neuroscience, philosophy, and linguistics. Theorists behind cognitive theory are Albert Ellis, Tolman, Piaget, Chomsky, and then lastly, one of the theories that I will discuss, which I believe is possibly the reason for mental illness, would be social theory. Social theory basically entails a wide range of social topics, including group behavior, social perception, leadership, nonverbal behavior, conformity, aggression, and prejudice. It is basically important to note that social psychology is not just about looking at social influences, but looking at social perception and social interaction. Theorists that help validate social theory would be Bandura, Lewin, Festinger. So basically, what I want to discuss as well is psychodynamic and humanistic approaches that basically reveal mental illness as well. Psychodynamic theories as well as humanistic approaches are extremely crucial to better understanding mental illness, seeing that they both pertain to life experiences and attempting to reach your full potential, both of which can be detrimental to individuals and cause mental illness. So I guess speaking of analytical, we can speak of Sigmund Freud, one of the greatest minds of all times. I know his work can sometimes just be discredited because some may say that he didn't really do any case studies, that he just basically observed the general population, but I personally think he is a genius. So Sigmund Freud is a Viennese neurologist. He believed that three central forces shape personality: the id, which contains instinctual needs, the ego, which employs reason, and the superego, which is a representation of an individual's values and ideals, such as your morality. Freud also proposed stages of development that require adjustments in the id, ego, and superego. Basically, if the proper adjustment doesn't occur, he says that the person may be leaded or headed for abnormal functioning. So basically, people who do not adjust properly to their needs or their instincts or even their morals may actually be put at a point where they will basically have a mental illness. Much like Sigmund Freud, there's our behaviors. One of the main behaviors, which is very famously criticized as well, John Brodus Watson. He basically argued with the ideas of Sigmund Freud. He insisted the psychology concerned itself with behavior in and of itself rather than level of consciousness. One of his most controversial quotes, which actually has to do maybe with his project Little Albert, which I will discuss, was, "Give me a dozen healthy infants, well-formed, and my own specified world to bring them up in, and I'll guarantee to take any one of them at random and train him to become any type of specialist. I might select doctor, lawyer, artist, merchant, chief, and yes, even beggar, man, and thief, regardless of his talents, penchants, tendencies, abilities, vocations, race of his ancestors." So basically, this itself showed that behavior can be manipulated to change a person and their thoughts. Basically, this quote in itself shows how nature and nurture may lead to mental illness. There's basically constant internal conflict and strife between an individual and what is expected of them. So John B. Watson held an experiment on a little infant named Little Albert. And basically, what he did was that he conditioned Little Albert to be fearful of white objects such as rats and dogs by associating them with a loud bang. So every time a loud bang played, the baby became fearful, meaning that every time he was petting a rat, the loud bang started and he would fear that animal. Many in society thought that it was a very cruel and unusual experiment, but he normally did experiments on infants and on organisms to see how stimulus affected their behavior. So as a result of that, cognitive theories emerged. Basically because of the misinterpretation that behavior therapy could manipulate or control individuals such as Little Albert. So cognitive theory emphasizes the mind's cognition in determining behavior, and it is basically based on a person's thoughts, feelings, beliefs, and perceptions. According to cognition theory, dysfunctional thoughts lead to extreme behaviors, which in turn lead to destructive behavior. One of the most well-known psychologists, Albert Ellis, was one of the ones who basically turned cognitive theory into therapy. Basically, Ellis noticed that irrational beliefs often led to extreme emotions. So words such as must, should, and can't were basically removed and replaced in a person's vocabulary to help them create a systematic and direct way of teaching. Basically, participants identified a challenge and replaced those irrational core beliefs with more rational and balanced ones through therapy. Social theory, as I have said before, is probably one of the roots of mental illness, or the root of mental illness in itself. Social theory dictates that social topics including group behavior, social perception, leadership, nonverbal behavior, conformity, aggression, and prejudice may all influence an individual and how they perceive themselves and the world around them. The environment, social perception, stereotyping, discrimination, and bullying all cause these irrational beliefs that Ellis fought so hard to correct. It basically causes fears towards the outside world and mental illness. Many may stay silent because they are afraid of being labeled as crazy, unfortunately. But basically, social theory dictates that social topics and group behavior affect how a person behaves. Um, Basically, there's one quote that really stood out to me when I was researching mental illness and mental illness awareness. It's by Andre Lankow, and it says, "To not have your suffering recognized is an almost unbearable form of violence," which I believe could not be more true, to be honest. Um, so now that we went over social theory and we recognize that being ostracized or also being unable to speak up due to our mental illness can be very detrimental and cruel, I want to go over humanistic approach and mental illness. Basically, humanistic theory approaches an emphasis on achieving an individual's highest potential. They are often grouped together with existentialist theorists because of their common focus on broader dimension of human existence. Um, they basically believe that people were born knowing how to be healthy and were naturally drawn towards making healthy choices, though these healthy choices were basically thwarted by teachers, religious leaders, or parents or other authorities that basically caused unhealthy behaviors. So, another major discussion that goes on is whether mental illness is a biological or chemical disorder. So, basically, from a biological standpoint, mental illness is a problem having to do with the brain and the components of the brain. Mental illness basically affects different components of the brain at various times and may cause different side effects, such as either physiological constructs, such as having cramps, pains, headaches, or it can also lead to mood swings. So many may actually say the biological aspect of mental illness is that something's not wrong, something's not right in the brain per se, and that's why mental illness comes about. While others may say that it's a chemical imbalance, and basically mental illness is brought upon a deficit in either serotonin, dopamine, adrenaline, norepinephrine. There are many different chemical imbalances that can actually occur, and many may say that depression may be led to low levels of serotonin. So many do argue that chemical imbalance is a valid theory for mental disorders. So I wanted to discuss if neurological conditions do in fact intensify mental illness. So basically looking at autism and predisposition to mental illness. Autism spectrum disorder is a complex developmental disorder that affects many individuals with impaired language, interaction, and sensory awareness. My son personally suffers from sensory disorder. So individuals with ASD are often overlooked when it comes to mental health just because they have so many developmental deficits. So ASD is neurological in origin but may be misinterpreted as a mental illness initially. It is actually a mental disorder. If you look at the definition between disorder and illness, a disorder is a disruption of regular body structure and function, making it more neurological in origin than psychological. So, criteria for autism, according to the American Psychiatric Association 5th edition of Diagnostic and Statistical Manual of Mental Disorders, would be one, that there are persistent deficits in social communication and social interaction across multiple contexts. 2, restricted or repetitive behaviors or patterns. 3, symptoms that must be present in early development. Basically, it may not become fully manifested until social demands exceed the capacities of those who have autism. So basically, those are the main criteria for diagnosing autism. According to the National Autistic Society, mental illness is more prevalent in individuals with autism spectrum disorder than the general population. The statistics are quite alarming actually. Roughly 40% of the symptoms or most, I'm sorry, roughly 40% have symptoms of at least one anxiety disorder at any time, compared with up to 15% of the general population. And unfortunately, many of these individuals on the spectrum have difficulty describing the symptoms. My son personally cannot talk, so being nonverbal, it's very difficult for him to tell me what hurts or what he's feeling. Um, they basically they're basically disabled due to their impairments. A sudden change in their behavior could possibly mean that they have an anxiety disorder. However, there's no complaint of a typical symptom, unfortunately. It's very difficult for individuals with spectrum in the spectrum to basically adjust and fit in due to societal norms and expectations and the ways that they are viewed, unfortunately. So basically, can mental illness be prevented in those with autism spectrum disorder? Well, I am currently doing early intervention with my son. As I said, he was diagnosed at 23 months, and now we are at 27 months, and we are currently doing speech therapy, occupational therapy, and physical therapy. We are currently starting, well, today we actually had our first analysis for applied behavior analysis, or ABA, which is basically considered behavior therapy in kids with autism spectrum disorder. So basically, all these therapies these can give an individual as much help as they need, or intervention that they need, in order to live a typical life, even though they are atypical. These therapies provide individuals the opportunity to learn how to speak and interact and behave in a way that is accepted by society and their standards. So basically, in conclusion, there are several theories and approaches behind what truly causes mental illness, whether it is biological, chemically imbalanced, pressures of societal norms, internal struggle between the unconscious and the conscious, or predisposition due to autism spectrum disorder. Mental illness is not something that is taken seriously as it should be, and the main reason it occurs is because many people are ashamed of the stigma associated of having a mental illness. Many brilliant philosophers, psychologists, and psychiatrists have paved the way to make mental health counseling what it is today. Mental health counseling has been able to provide a framework for understanding clients and helping them with their problems, along with early intervention for those that have autism spectrum disorder. It gives them a chance to live in society and not be ostracized by society. So I guess my main goal with this topic that I chose was basically to spread awareness and to help end stigma. I personally started studying psychology just because I had an interest in helping people, and I feel that mental illness is part of one of my strong points, just because I've been there and I know what it's like. So, Carl Jung once said that knowing your own darkness is the best method for dealing with the darknesses of other people, and I honestly don't think he could be any more right than what those words signify. It's honestly really true. Me going through everything that I have gone through with my son, with my mother, with some of my other peers, it's what has helped me grow as a person and has helped me to help others who have had the same issues I have had. So that's why I wanted to discuss this topic. I know it may be more informative than research, but I believe that it is something that's very important to discuss. So thank you for your time.